signs and symptoms during week 4. Today we are talking about the changes that do happen when you are at 4 weeks pregnant, and what are the signs and symptoms of a mother who is pregnant at 4 weeks. These are the changes that will take place in your body when you are at 4 weeks pregnant. So we talked about the changes that happen during the first week, the second week, the third week when you are pregnant in our previous videos. Before we proceed, you can always go visit and check out all the videos we put out during the first week, second week, and the third week, so that we can catch up to where we are. But without further ado, when you are 4 weeks pregnant, there are changes that are going to happen. The first thing we need to realize is that fertilization took place in that part known as the ampulla, or the ampullary part of your fallopian tubes. The fertilized egg came down through the fallopian tubes up to the uterus, and then during week 2 and week 3 it did what we call burrowing, or it attached onto the endometrial wall or your uterine lining. So right now at 4 weeks, the burrowing or the attachment of the fertilized egg onto your uterine lining goes on deeper, and actually it digs deeper and it attaches deeper onto the uterine lining. But remember, at this stage they are a collection of cells. These cells are what we call the blastocyst. So these cells divide into two. The outer layer is what we call the embryo, which goes on to become the baby, or it goes on to become the fetus. And then the other second layer which divides is what we call the placenta. The placenta is that part the baby is going to be using for feeding and for exchange of gases, that is respiration, and then also to expel waste products while the baby is growing. So at 4 weeks pregnant, what happens mostly is that the attachment of the fertilized egg onto your uterine lining goes on deeper. There's cell division whereby the embryo will form and then the placenta will form. The other thing we need to take note here is that there is a division of cells further going on, and the embryo, the developing embryo, is divided into 3 layers. We have the ectoderm, which actually goes on to become the nervous system, and then we have the mesoderm, which goes on to actually grow into the lungs, the heart, and the liver, and then we have the endoderm, which actually also goes on to form the bowels and then to form the inner structures. So basically at 4 weeks pregnancy, the changes normally are cell division and then growth of the developing embryo. Those are the key points we need to take note at 4 weeks pregnancy. We are still proceeding with our lesson for today, the changes that do happen when you are at 4 weeks pregnant, and specifically for you to get the new videos we put out daily, please remember to hit the subscribe button, like and share this video so that many of our pregnant mothers and those mothers to be pregnant can get this knowledge. It is very key. We are talking about a series of changes that do happen. We started with week 1 and we are proceeding up to week 40. Remember, there are supposed to be 40 weeks of growth. If you get pregnant, like you've been told that you are pregnant, remember that you are going to carry our baby, you're going to carry the pregnancy up to 9 months, and when we do the calculations, normally we expect you to be giving birth at 40 weeks pregnancy. But mothers can go on and give birth at 42 weeks, and even others, more so the ones called the prime gravidas, or those who have never delivered, may give birth earlier on, but the recommended age is 40 weeks pregnancy. So we are proceeding please remember to hit the subscribe button. We've talked about the changes that do happen at 4 weeks pregnancy, and we've said that the fertilized egg, which is also known as the blastocyst, goes on dividing, forming the embryo, and then also it forms the placenta. And the placenta is that part the baby will use for feeding and also for respiration and for removal of waste products and also for exchange of hormones through a process of physiological changes. Then there's also the embryo that is going to go on to form the baby. At 4 weeks pregnancy, if you are to have twins, at 4 weeks pregnancy, the twins will be seen on ultrasound scan. So what are you expected to do at 4 weeks pregnancy? You are expected to go see your midwife. You can always decide and choose which midwife or gynecologist or doctor you would like to see at this stage of your pregnancy. You are supposed to go and attend your prenatal care. Not many drugs will be given at this stage, but specifically health education like we are doing right now will be given to you. In some countries, the doctors or your GP will recommend that you begin on folic acid, but remember, folic acid tablets, but remember this decision has to be made strictly by your doctor or your midwife. Please do not do self-medication, as this information we do give out is for information purposes only, is for education purposes only. Go see your midwife, your gynecologist. If you have done the urine pregnancy test at home and it is positive, at 4 weeks pregnancy, you should go and then you do your antenatal, you do your consultation. And then also what you need to take note is that at 4 weeks pregnancy, since there's more of cell division happening, you are expected to stay away from secondary smoking, or if you are a smoker, you are a pregnant mother, you are a woman and you smoke, you are supposed to stop. The main reason is inside the cigarette smoke there are chemicals that are really dangerous. Remember, we are talking about cell division is taking place at 4 weeks here at this particular stage. So there are high chances that when you do smoke, when you do take alcohol, when you expose yourself to various drugs and chemicals, there are high chances that these can filter into your bloodstream through the placenta. Remember, we said that the placenta will be forming at this stage, and it will not be good news for the chemicals in cigarettes or in alcohol to filter to our growing baby, to the growing baby. This is really not good, because it can end up bringing about what we call teratomas or abnormal growth abnormalities to the baby. So please stay away from cigarette smoking, stay away from alcohol. You should not even try wine, though some mothers can take an excuse that wine is good. Remember, it is still alcohol. It still has the alcohol component in it. Stay away from stressors. You can actually manage stress by avoiding the stressor. You can also alter the stressor. You can adjust to the stressor. How do you adjust to the stressor? You adjust to the stressor by understanding that people are not perfect. If it's your partner, it's always good to understand your partner's weaknesses and then strength, and then do not focus on their weaknesses, focus on the strength. And of course, if the stressor or if the issues are really so big, then you are required to discuss this with your family. And then also you could also go for counseling or therapy sessions. The main reason is that a pregnant mother who is constantly stressed ends up having high levels of cortisol. Cortisol is a stress hormone. Normally cortisol may interfere with the normal growth of the baby, and that's why we recommend that pregnant mothers at least should find ways of handling or managing the stress. The other thing is that cortisol can even lead to miscarriages. So when you try to make an assessment, the majority of the miscarriages, though some do happen naturally, but mostly they are also attributed to either stress excessive stress in a pregnant mother, or even they may be attributed to infections or disease going on through the reproductive system. So at 4 weeks pregnancy, we've said that you should practice healthy habits. You should also have a balanced diet. Try to balance your diet depending on the available foods. You can still discuss more with your midwife. The other thing we need to talk about at 4 weeks pregnancy is that at this stage you are supposed to have an ultrasound scan whereby changes will be seen in the growing embryo. At 4 weeks pregnancy, we expect really to see at least an embryo growing, as we've said. So at this point, thanks a lot for staying with me. We've talked about the changes that do happen at 4 weeks pregnancy, and what we need to take home in today's lesson is that at 4 weeks pregnancy, there's that embryo that is attaching onto the uterine lining. The embryo is dividing into the placenta and the embryo part. There's also a yolk sac that is going to form the digestive system. It's also actually seen at 4 weeks on ultrasound scan. Then also at 4 weeks pregnancy, there are actually great changes happening in we can see the gestational sacs if at all they are twins. And yes, let me know if you have any questions for me in regards to pregnancy at 4 weeks. You can even ask at any particular week, even 30 weeks or 38 weeks. Let us discuss those questions down below in the comments. And please remember, learning does not stop, so I can learn something from you. You can learn something from me. Please hit the subscribe button. Share this video with all mothers and mothers to be, and even your husbands, because this knowledge is very important. Remember, when a mother is pregnant and she gets the right knowledge, there are high chances that the changes she'll be getting, for example, the changes that are being brought about by the increasing levels of progesterone, increasing levels of the hormone, pregnancy hormones, for example, progesterone and estrogen. For example, increasing progesterone in the body can bring about the bloating, the nausea, the stomach fullness, and then the feeling of like you want to vomit. Once you have this knowledge, you can always know how to deal with all these. Let me answer all your questions down below in the comments. Thanks for staying with me for today's lesson, Pregnancy Changes at 4 weeks. I'm called Gerard Massa. I'm a health educator. Have yourself a fantastic and healthy day.